leading causes of blindness world over. The burden of glaucoma-induced permanent vision loss is increasing rapidly in the coming years and is becoming one of the very leading cause of irreversible vision loss. काले मोतिये से जो रोशनी गई, वो कभी वापस नहीं आती. That is why it makes it very important to be diagnosed at the right time, at an early time, and be managed. Glaucoma basically is an optic neuropathy, means it causes damage of the optic nerve of the human eye. The optic nerve we can see in the eye as an optic nerve cup head. We quantitate the damage on the various parameters which we see on the changes which we see on the optic nerve head. Intraocular pressure या आंखों का दबाव pressure is the only modality which we have as of now to regulate or to manage in a glaucomatous patient. The normal intraocular pressure is considered to be from 10 to 20 millimeter of mercury. Pressure above 20 clearly can be a sign of glaucomatous damage, though not very sure. But that doesn't mean a pressure of less than 20 can't have glaucoma. You can have a normotensive glaucoma or ocular hypertension or various types of glaucoma. Glaucomas are basically classified into two types, the angle closure and the open angle. The open angle, which is difficult to diagnose, is more prevalent than the angle closure. A patient of angle closure glaucoma usually presents with halos around light, with severe pain, redness and diminished vision. सिर में घुपे चलते हैं. That's a typical what the people say, and that is very easy to diagnose and manage. On the other hand, open angle glaucoma doesn't present with any sign. It is to be looked and diagnosed and managed. You have to check the pressure, the optic nerve head and the various other diagnostic tests so as to confirm it and treat it. There are various methods or investigations to diagnose the glaucoma. The foremost being a physician's examination of the optic nerve head, and the changes which can be seen over there can be either noted down or serial photography over the years help in making the diagnosis very clear. Especially in the early stages. In an established case, optic nerve head clearly clinches the diagnosis. Gonioscopy, measuring intraocular pressure by various methods, and then further investigations like visual field analysis and OCT analysis of the optic nerve head are the upcoming diagnostic methods so as to diagnose glaucoma. Now, important thing is who all are at risk of developing glaucoma. Patients who have a family history of glaucoma, very, very important. They should never hide it from their physician or from their ophthalmologist, or they should rather go and say, sir, I've had a family history of glaucoma and please check me accordingly. Diabetic, hypertensive, patient with compromised cardiovascular status or with sedentary lifestyles are more prone to have glaucoma or glaucomatous changes in their eyes. Timely diagnosis helps us to clinch the problem and to solve it and to prevent blindness. Modalities of management are laser, medical and surgical. Most of the patient, I would say 90% of the patient can be managed on medical treatment, and it is very easy. Putting one or a couple of drops depending upon the pressure and the target pressure and what is to be managed can be done, and this is save the burden of surgery and is a very good control measure. But again, the important thing is, once diagnosed as glaucoma, you can forget to take your food, but you cannot forget to take your medicines, your drops. You have to be very sure and very particular, or else the damage if done will not be reversed. So dear friends, if you have a problem of glaucoma in your family or the risk factors as I just enumerated, go and get your eyes tested. Or I would put it in very simple terms, any person above the age of 40 should have a thorough fundus examination and should specially ask your ophthalmologist kindly look for any other such changes. Thank you.